Often look at microbiome support. So that's probiotics. So probiotics is such a peculiar subject, honestly. We all have a healthy, in dogs, people, everybody, we have a healthy gut bacteria. That means in our intestine, there's all these bacteria that are there, and they help us to digest things, and they help to manufacture certain vitamins, actually, that are beneficial for us. That's the very basic approach. And if you look at things like cows, if they don't have their microbiome, which is the word for the healthy bacteria, like they will definitely die because they totally require a healthy microbiome for digesting things like grass. Now, people and dogs, which are pretty similar in a lot of ways, when the microbiome gets messed up, which happens many, many times when chemotherapy agents are being used, as an example, sometimes when anti-inflammatories are being used, pharmaceuticals generally, sometimes when there's a sudden diet change, all of these things will impact the environment within the intestine. And the environment within the intestine will change. The pH will change. The composition of the fluids inside the intestine will change. And it'll favor the growth of unhealthy bacteria. And so our bodies are covered in bacteria. And our stomach and our intestine are a surface in the same way that our skin is a surface, even though it's inside of us. So the GI tract, which is the mouth, the esophagus, the stomach, the intestine, and then the rear end, that's a tube. So it's kind of like we have the skin and then it goes in, and that's a surface too, if that makes sense. So what happens is that the surface of our bodies, because it has healthy bacteria and also a little bit of unhealthy bacteria there, which is a consequence of living on planet Earth, when the conditions are right, we will get an overgrowth of the unhealthy stuff. And when you get an overgrowth of unhealthy bacteria in your intestine, which is created by antibiotics, pharmaceuticals, sudden diet change, chemotherapy agents, whatever, radiation, the unhealthy bacteria will say, hey, look, the pH has changed, the CO2 has changed, the trace minerals are changed. I'm happy. I'm going to start to grow. And the unhealthy bacteria start to colonize, and then they grow. And then what do you get? Then you get this weird diarrhea that doesn't go away. Like, well, all right, well, I'm done with this drug, or I didn't feed the food anymore. It's 4 months and my dog still has diarrhea. What in the world? And that's how you can get years of diarrhea because you gave your dog the wrong biscuit. That actually can happen because the microbiome changes and you get a permanent shift until you address it. So how do you do it?
I was going to say, well, how do you address it?
Enter probiotics. So that's one of the ways you can do it. So you need to provide the body, you have a garden that's full of weeds. What do? You need to take out the weeds and you need to put in the new healthy plants, your fruits and vegetables and flowers. So that's called probiotics. You put back in the body the healthy bacteria that it needs. And those healthy bacteria need to colonize. Now, here we have a problem. Because one of the things that people don't realize many times is that the probiotics all by themselves usually only last 4, 5, 6, 7 days or something like that, all by themselves. So you need to give them prebiotics. So they need to be given food. So if you were to put some seeds out on a road that has a half an inch of dirt, those seeds will grow a little bit and then they will not grow. So you need to give soil and you need to give food and sun and water. So you need to fertilize your probiotics. And how do you do that? You give them probiotic food. That's called prebiotics. And so in the products that have probiotics plus prebiotics are called symbiotics. So that means you've got your probiotics combined with your food for your probiotics. That's called a symbiotic.
SYN?
Right.
Okay.
So SYN biotic. So I use Proviable or Fortiflora or something like that. And those are nice because they have these long chain carbohydrate molecules that are not digested by the animal, by the way. They're not digested by the animal. We can't digest them, but the bacteria can digest them.
It's feeding the probiotics.
Feeding the probiotics, yeah. So you do this for a while, and then if you've got a bacterial overgrowth, you need to do some metronidazole or something that you get from the vet often to get rid of the bad bacteria because you got to pull out the weeds. So you replant, but you got to pull out the weeds.
And so you're saying an antibiotic like metronidazole is what pulls out the weeds?
Actually, it's a very particular type of antibiotic that does not promote bacterial overgrowth. And a lot of times we'll actually use metronidazole. We'll send it home with people who are starting a cancer therapy plan or program because occasionally something will upset the tummy. And that can happen with anything. Like some dogs, if you give them new dog food, they'll develop diarrhea plus or minus blood.
Hmm.
And then in rare cases, those dogs will end up in the hospital. It's like, I just changed my dog's food. What in the world? How did this happen? And you can get hemorrhagic gastroenteritis as a consequence. And that in a little dog, that can be life-threatening. It's crazy. It's like, how did that happen? Well, it's a bacterial overgrowth thing. That's how it happens. It's just crazy.